Dear Dr. Tedros, Dr. Teresa, ministers, partners and friends, TB remains one of the humanity's deadliest infectious diseases, and it should not be. We have the tools to prevent, diagnose and cure it. Yet millions of people still fall ill every year. And that's why today's message matters. Yes, we can end TB, led by countries powered by people. Since 2015, TB incidence has fallen by nearly 40%, 40, in the WHO European region, and deaths by almost half. Yet, in 2024, about 204,000 people developed TB. And tragically, around 19,000 people died. But we are making progress, yet not fast enough. In recent years, the European region has also been experiencing the largest population movements since the Second World War, reshaping health needs and testing the resilience of our health systems. In this context, tackling TB and particularly drug-resistant TB, a major form of antimicrobial resistance, is not only a public health priority, it's a critical investment in health security across borders. Behind these numbers are people, real people, whose lives depend on what we do next. So what do? I will outline 4 critical actions. 1. Innovate. Science is moving fast. Rapid molecular diagnostics can now detect TB and drug resistance in hours. Shorter, safer treatment regimens are transforming care for drug-resistant TB. Important in the European region, where we have the highest burden of drug-resistant TB globally. The launch of WHO's first guidelines on near point-of-care TB diagnostics today is a vital step forward that brings testing closer to communities and primary healthcare. It means earlier diagnosis, faster treatment, fewer lives lost. In a region facing increasing mobility and antimicrobial resistance, the early detection of TB and drug resistance is crucial for health security. Our job is to make sure these tools reach every country, every patient. Second, strengthening regional cooperation. TB is not limited by borders, and nor should our response be. In Central Asia, countries are working together through my special TB-free Central Asia initiative to address migration, cross-border transmission and DRTB together. In the western part of our region, TB once was close to elimination, but today, humanitarian crisis, population movement have completely changed the situation. Drug-resistant TB is again a concern, and structural barriers exist, limiting access to newer, shorter and affordable treatments. We are building regional cooperation and working to overcome those barriers. Third, we turbocharge investment. There is still a mismatch between the burden of TB and the resources available to fight it. We cannot allow TB to slip further down the agenda. Investing in TB is one of the smartest investments in public health. Every dollar invested in TB can generate over $40 in economic return through healthier populations, stronger economies and resilient societies. Ending TB requires sustained political commitment and financing. Lastly, and most importantly, we put always people first. TB is a disease of inequality. I know I will always be a TB doctor in my heart. Poverty, undernutrition, HIV, diabetes, smoking and alcohol use fuel the epidemic. Too many still face catastrophic costs because of TB. That's why our response must always be putting the people at the center. Communities, survivors and civil society are not just participants in the response, they are the leaders. My friends, ending TB is within reach. The question is no longer whether we can end TB, because we can change the course of the epidemic. We can save millions of lives. The question is whether we will. And the answer must be yes. Yes, we can. So today, let's recommit to innovation, cooperation, investment, and the people. Thank you. Good luck.